Thank you, Amanda and Cassandra. Our first discussant for this first session is Hilary Seligman from the University of California, San Francisco.
Well, thank you first to the conference organizers for allowing me to discuss these really wonderful papers with you all, and a special thank you to Dr. Nguyen, Dr. McClain, and Dr. Johnson for really interesting presentations to talk about for a minute. Can everybody see my screen correctly?
Yes. Looks great.
Okay, thank you. Okay, so I want to start by acknowledging that one of my tasks here was to try to contextualize this work a little bit, but also to pull in a little bit of my own work to try to understand how this fits with some things that I've done over the years. And I'm going to try to do that while giving you some big picture thoughts about how we can use these really interesting results about American Indian, Alaska Natives, and Latino immigrants to move forward with better measuring food insecurity in the US. And the first thing this calls to mind for me is how very contextually bound experiences of food insecurity are in the United States, and how very unique every individual's experience is. And it calls to mind for me a project that I did quite some time ago that was examining the experiences of Chinese immigrants to San Francisco with regard to food insecurity. Because as a San Francisco resident myself, the Chinese immigrant community seemed very left out of our understanding of food insecurity locally, predominantly because it was very challenging to assess and measure food insecurity in that population because there wasn't a validated translation of the food security survey module. What I want to bring out today, though, is that we learned a number of very important things about how unique Chinese immigrants were experiencing food insecurity in the United States. And they brought in two coping strategies that were very frequent in that community that I infrequently was hearing in other communities. One was the idea that if they drank water all day, they would not feel hungry and therefore did not need to indicate ever that they were going hungry on the food security survey module. So that was one example of an individual coping strategy that was frequently used in that community that maybe is less frequently used in other communities. And the other was a shopping strategy. And that is that the culture in Chinatown, at least in San Francisco, is that the food stores discount deeply many of their fresh food items in the last half hour before the store closes. And so all of the shopping would be done just before close of business. And I add this just so that we have one other unique subpopulation to think about when we think about disparities in food insecurity rates in the United States. This is the official USDA numbers from 2020. And I want to just call attention to two items, since these are things that I think are really brought out by the talks today. The first is the lack of an estimate for American Indian, Alaskan Native populations at all. And I think this is enormously important because the lack of data tends to make that population invisible in the way that we address food insecurity in the United States. So I think it's incredibly important that that population end up on the graph, so to speak. And the other is the idea that Dr. McClain and Dr. Johnson just alluded to, which is that even the very high prevalence rate of food insecurity in Hispanic Latinx populations may actually be an underestimate of experiences of food insecurity, meaning that we may actually be underestimating disparities in food insecurity rates. And so this brings me to sort of an underlying, I think, important point to think about when we're thinking about measuring food insecurity differently and reporting out separately in different race ethnicities, and particularly attempts to better disaggregate the measures so that we can see, monitor, and hopefully improve food insecurity rates better in specific race or ethnic populations. And that is a reminder that race is a social construct and not a biological one. Or in other words, there's no inherent propensity that one race or ethnicity will be more food secure or food insecure than another race or ethnicity, that really what is explaining these differences is policies and practices that impact different races differently, whether those are impacting different races differently intentionally or not. And that is another way of saying that there is inherently racist practices and policies that are in place right now in the United States that are making it more likely for certain racial and ethnic subpopulations to experience higher rates of food insecurity. So one of the ways to think about this is within the context of the social ecological model, to understand that even though we talk today about the individual and the household experiences, these are very contextually bound and rooted in one's community and in one's in the policies and systems that are in place that constrain our behavior. And so I just want to give you a couple of examples of how this might play out from my own work. And of course, the work of many collaborators and colleagues who I have the good fortune to work with. This is an example from during the pandemic, and what it shows you in those light gray bars is the number of school-prepared lunches served in 2019, prior to the pandemic starting. And then again, the number of school-prepared lunches in the dark gray boxes in 2020. One of the things that we know is that a school-prepared lunch has fewer calories and is more nutritious on average than a lunch prepared from home. And what you can see then in the dashed gray line is the excess number of kilocalories per month in billions that are thought to be, that we estimated were associated with the conversion of lunches from National School Lunch Program lunches, which again have high nutritional standards, to home lunches. Now, one of the things we know is that the excess burden of not having access to free and reduced price lunch falls more heavily on minority households, Black, Brown, American Indian, Alaska Native households. And so really the burden of the pandemic in terms of nutrition and food security most likely fell most heavily on those populations. In addition, for those of you who listened to Secretary Vilsack's talk 2 weeks or so ago about the future of food security and nutrition security in the United States, and specifically the way it's being conceptualized in the USDA, there's really been increased attention focused on the importance of having the right calories and not just a sufficient number of calories. And so the term nutrition security is increasingly being used to recognize food security plus the components of diet quality and equity. And I think this is incredibly important as we think about disparities in food security and downstream health implications of disparities in food insecurity that have implications for nutrition and diet-related disease. And I'm going to give you one example of that, which is the quality of foods available through the charitable food system. This is the nation's network of food banks and food pantries. And this is a complicated slide. You don't need to, the specifics of the slide are not important. What is important is to recognize that in many households, and particularly in minority, racial, and ethnic households, food gaps are often met by seeking out food from the charitable food system. And so there is an incredible importance to making sure that the food available in that system is healthy and provides access to nutritious food. But the way that we do that has to be rooted in cultural competence and in understanding different dietary preferences, cultures and histories of different foods in different communities. And so one way that we can do that is to support the increase of healthier food items through these systems without specifically saying which food items are more or less valued, but instead ranking the nutrient quality of the foods based on how much, for example, sugar is in the food, sodium is in the food, or saturated fat is in the food. I want to mention two other items that I think have become especially important with COVID-19, and one is the fragility of our food system. I think historically we have taken for granted the stability of our food system, and COVID-19 has clearly thrown that into a little bit of question. And I think some of the interviews that Dr. McClain and Dr. Johnson highlighted for us really showed us how fragile that food system can be and how that might change people's understanding of their food security, but particularly those populations that might be more sensitive to gaps in the food supply, such as households with lower household income. I also want to point out that as food insecurity worsens, dietary intake tends to worsen as well from a nutrient perspective. And these are the very things that predispose people to diet-sensitive chronic disease. And as we saw in the COVID-19 outbreak, that these poor health outcomes were really highly associated with morbidity and mortality from COVID-19 as well. So it's really important to understand these all together. And finally, I want to end with this often maligned quote by maybe Peter Drucker, although people disagree, the original author of this, so you can't improve what you don't measure. And while there is risk of being a slave to measurement, I think it's incredibly important that we start being better measurers of food insecurity in different racial and ethnic subgroups, because the experiences can be so different. And this creates a case for data disaggregation, including among Latinx populations, American Indian, Alaska Native populations, as our speakers talked about today, and also in Asian populations, to make sure that we're measuring what we think we measure and that we can track progress towards reducing disparities in food insecurity and reducing disparities in health outcomes related to lack of access to healthy and nutritious food. With that, I will turn it over to the conference organizers again, and thank you all for listening to these thoughts.
What a terrific set of presentations, and thanks so much, Dr. Seligman, for the discussant comments, which were informative and helped set this in the context of an important area of work. As questions come in, I'll try to follow them, and Sarah Van Ness will also help me with screening. One of the questions already in is about the balanced meals question. I think it's a point of interest across a couple of these presentations. Perhaps Amanda or Cassandra Johnson would be interested to comment first about the balanced meals. It's especially interesting in the context of Hilary's discussion of nutrition security and the current interest in nutrition security, because it's sometimes said in nutrition security circles that the food security doesn't pay attention to nutrition, and the balanced meals might be one of the questions that most closely connects in one way or another to nutrition. So what are your thoughts?
You want to go first, or you want me to?
Go ahead.
So I'll share some things off the top of my head, and then I just pulled up some notes too in case we need it. But one thing that we have started to see, even though we haven't done all the interviews we want to do, so a lot of times when we think about nutritional principles around eating occasions or meals, we think about things like adequacy or variety, things like that. And we have started to see some of that. I'm going to stop, let my colleague share more, and then I'm going to check to see if there's anything else I can offer kind of on the spot. It's a great question.
Yeah, and kind of, going from what Dr. Johnson said, I think too, as we proceed with more interviews and are honing in on specific dig in the cognitive testing piece, we'll be able to do more, spend more of time in the interviews with the exploratory part, which can dig a little bit deeper into that. But I think also too, just having this opportunity to do the cognitive testing and allow participants to tell us what they think these things mean and how they would prefer it to be said. So I think between both the cognitive testing and refining that wording, as well as the exploratory interviewing, that can pick up on more nuances about the experiences of Latinx households, that I'm pretty hopeful that something that is more representative of their experience can come out of this work.
Amanda, if the balanced meals is a question that's got this connection to nutrition, are there any other questions that stand out for their distinct role in this battery of items? In other words, as you think about what's distinctive about Latinx households, do you think any of the other questions capture experiences in a way that's distinctive for a particular population?
Specific to Latinx households or more generally?
Either. Answer either. Yeah.
Yeah. Well, I do think that, and this is, and, I spoke briefly about this and so did Dr. Johnson in our presentation about this idea that there's always something to eat. And what we know from previous research with Latinx households and Latinx caregivers is that something always to eat maybe isn't what they is their ideal, but it is still often nutritious when we think about, you remember the quote that said about the beans and rice, there's always beans and rice. That's not necessarily what many people broadly, not necessarily those of us that are involved in this research, but broadly think about food insecure households reaching for, right? Necessarily. So I think that there are opportunities to integrate some of those types of things into there's this idea of always something to eat, but how can we better capture what their experiences are beyond do you or your children skip meals or things like that, things that they are saying doesn't happen, but maybe there's like other types of nuances there that we can integrate into the language. I don't know if Dr. Johnson, you have anything else to add to that?
I was going to add, because I feel like it's already come up, kind of thinking about positive and negative things, like, are we kind of capturing some of these nutritional aspects related to food choices and eating that are maybe more relevant for thinking about nutrition security? So far, it seems like the question about balanced meals, more of that is kind of emerging from that response. And because so many of the questions are framed in a more negative way, like the absence of this other thing, references to nutrition, thinking about variety and balance, especially as it comes to things for the kids, are coming out kind of throughout responses. And it's just going to take us more time to filter through that and make sense of those data.
Great. From Saeed Tusi, we have a question which is about sort of division into populations within the United States and then division into subpopulations. But in fact, I want to pitch this question first to Dr. Nguyen, because it's true also for the American Indian and Alaska Native. So my question is, to what extent does this interest in interpretation by different populations seem consistent with the goal of having a national canonical measure? Or to what extent does it require us to, slightly set aside our ambitions for that canonical character, that sort of unified character to the national prevalence estimates? And then I'm going to turn to Amanda and Cassandra right after. But first, Dr. Nguyen.
Yeah, can you hear me?
Yeah.
Okay, great. I just took my headphones out, so I wanted to make sure. Thank you for asking that question. I think that that's like a core tension in this space. And I think it's really important that we pay attention to how we are going to address that moving forward. We've touched on two groups where there's potential need for supplement or alteration to better characterize their experiences, specifically for my presentation, American Indian, Alaska Native groups, and then for Amanda and Cassandra's presentation for Latinx populations. And I think those are just two of many other subgroups that we might identify that are going to have unique language in contrast with the language that's used from the 1990s from low-income women that are predominantly white. And I think that there are ways that we can make either supplements or alterations with kind of our advanced surveying methods with kind of display logic And it's in an area of much interest to myself and my colleagues in this area of Indigenous food sovereignty and Native food security. So I think that this is an area that we're really interested in, and if there's a possible way to have dialogue with USDA in the forward steps to ensure that Native voices and voices of the different communities that may have these tailored versions of the food security survey present at these conversations, I think that's the way that I would suggest moving forward.
Sometimes as you start to think about divisions, one thinks, hey, maybe different measures are needed. And then when you think within American Indian and Alaska Native and within Latinx communities, even divisions within that, it almost, for me personally, starts to return my attention to thinking about the value of a national measure. At one point in your essay, as you were thinking about the high rates of food insecurity for African Americans and for American Indians and Alaska Natives, you had a short reflection on intersectionality. And I wondered if you wanted to mention that.
Yeah, thank you. I think that intersectionality is something that I'm not an expert on, so I'm only going to reflect on the aspects where I can reflect on intersectionality within American Indian and Alaska Native communities, where we think of the 600 plus tribes and villages that I made reference to in my presentation, that the food practices and actual foods are going to vary. One way to allow for heterogeneity within the American Indian and Alaska Native umbrella term is to recognize the use of geography as a segmentation strategy. So looking at region of the US. So for example, we're in very early stages of thinking about how to address food security in a strengths-based way within American Indian, Alaska Native community locations, and starting with a question that asks about region of their tribal identity, and then filtering to questions that demonstrate foods that are from those specific regions while having the language consistent across them, but the foods being referenced vary. So that's one way to allow for, to reflect and acknowledge the intersectionality and complexity within some of these umbrella terms. But we're in the very tiptoe early stages of that work. And so I'm not capable of talking about it in a more nuanced way.
That's great. I wanted to let Ana Poblacion, who's going to be speaking later today, offer her question that's going through the chat, but I wanted to give you a chance to share it in live time here. Anna.
Hello. Can you hear me?
Yes.
Okay. I was just wondering that I saw that your sample size was majoritarily composed by Mexican people, and I'm a Spanish speaking person, and I know that Spanish from Spain is different from Spanish from Mexico and from all Latin America. So I was wondering that if you're gonna research other people than Mexicans to have a broader sense of this understanding of syntaxes that are so different within the Spanish speaking community.
Yeah, no, and there was another question I saw in the chat similar to that. Yeah, absolutely. That's our focus moving forward, is to make sure that we are recruiting more variety across the different heritages. This is particularly relevant in New York City. As many of you probably know, the majority heritage in Texas and California, Southern Texas, Southern California, is Mexican, although we do have other Hispanic, Latino heritages in these areas. But particularly New York, the focusing a little bit more on trying to recruit Dominican, Puerto Rican, and perhaps some other Central American, I think, is predominantly Mexican at this point, but it is one of our priorities to be able to get more variety of heritages for this reason. It's already coming out in the 19 interviews we've done so far that there are different preferences in terms of how, in terms of preferred language for the Spanish food FSSM.
Great. And also going through the chat, Alicia Coleman Jensen had a question that might be so now at this point covered, but I'm not sure of that. Alicia, do you want to share a question or comment?
Hi, sure. So first, my preface is that I'm not a Spanish speaker, but I noticed there were some differences in the Spanish translation that you're using versus what ERS uses in our surveys. And I just wondered if you could speak to that and your plans moving forward.
Was there a specific one that you were referencing? Because we were using the Spanish.
So like the
ERS.
response option of frecuentemente instead of a menudo is one of the differences.
No, we used a menudo was in the FSSM Spanish version, correct?
No, for frecuentemente is in the Spanish version.
I don't know. I'd have to go back and look at particular questions, and I can get back to you on that.
Okay, thanks.
Great. Sarah, do you have any suggestions for next?
No, I think we covered a lot of discussion about intersectionality and kind of representation of different subcultures within the samples you're looking at. So any further comment on that would be great.
I just have a thought from my own experience doing cognitive interviews with Chinese speakers. I think I'll just mention two of them. One is that it's a very, and I am not a Chinese speaker, and so I am just reporting this out, and I apologize if I make any errors. The Chinese speakers that we interviewed also had challenges with the construct of a balanced meal, and while most of them understood it in the context of nutrition, there were a substantial number of people who understood it in the context of hot and cold, which is traditional Chinese medicine. And so, real efforts to correct that language were needed. And the other is to say that the same issue in Chinese happens in Spanish, which is that there are multiple official dialects. And so it's very challenging to come up with one translation that does not sound awkward to some people from some different province in China. And so the deeper we get into understanding and honoring different backgrounds and contexts, the more splitting we can continue to do. And I agree with you, Parke, that we have to come to a happy medium there. So that was my input. Thank you.
Thinking about connections across the different papers over the course of the day. Cassandra Nguyen, your paper had some interest both in personal and in household level food security measurement, which is something that we're going to hear about later from Aranda and Rebar. Do you have any comments on that part of what you studied, or and consider that an optional question? If you had any comment on any of your results that were related to individual versus household level food security measurement.
Yeah, thank you for that question, Parke. And before I answer it, I just wanted to quickly provide a kind of comment or reflection in acknowledgement of the session that Hilary led, in the comment that she provided that providing, or the disaggregation of racial and ethnic respondents is really incredibly important in the visibility in their discussion of kind of policy decisions moving forward. And so that was really the impetus behind our work. And it's something that I realized that I didn't acknowledge in our presentation, to argue for the validity of the questionnaire or argue for adjustments would be in pursuit of the representation of American Indian and Alaska Native respondents outside of this other category in the annual report. So I wanted to make that clear and thank Hilary for making that note in her session. And then to respond to your question, Parke, about individual in contrast with household experiences of food insecurity, we already have evidence to suggest that there is going to be variations in experiences of food insecurity within a household. And our study was not able to kind of reflect on that, given the National Health Interview Survey relies on the 10-item adult food security survey module. So in my discussion that I went through very quickly in the pursuits of time, acknowledging replication of the study in the current population survey that has the household indicator of food insecurity would be valuable. And then I also know that the National Health and Nutrition Examination Survey, at least for a number of years, has some separate indicators of food insecurity from individuals in the household in contrast with at the household level to better kind of illustrate where those differences arise and the consequences for the prevalence estimates that we produce. So thank you.
I was just realizing that also came up somewhat in, I think, in McClain and Johnson's paper, this sense of the diversity of experiences. I was kind of touched. I remember, as a young parent, knowing everything about what was going on in my children's lives, and then hearing that some of the people who were interviewed weren't sure whether their children were experiencing. I was thinking about, yeah, that describes my life as a parent of teenagers. As the kids get older, the parents don't always know what's going on in their lives. Great. Rodrigo Aranda, I don't know if you wanted to offer a comment in on screen, or if we'll just share your chat question to the Q&A session. Did you want to pose a question or comment? Great. Okay, so we'll wrap it up there. We're going to have a break. I greatly enjoyed this first session. Thank you to the participants, the three papers, and Dr. Seligman for the discussant comments. And we've got a slide that will go up saying that there will be a break, I think, for a certain period of time. The slide will clarify for me until 1 p.m. And then we look forward to talking to you then for session 2.